Hello, everyone, and welcome to Rad Chat. Welcome to podcast number 21. My name is Naaman Joker Anderson, and I'm joined by my fellow host, Joe McNamara. Thank you to our
Hi
last guest,
everyone!
Amy Rylance, who talked about working at process improvement projects. If you haven't had a chance yet, please do go and take a listen. So we're pleased to introduce our guest for this evening, Sara Liyanage, who will be discussing her experience of cancer treatment. Hi, Sara.
Hi, thanks for having me.
No worries. So, Sara, please could you tell us a bit about yourself?
Hi, thanks for having me. Yes, so I'm um 47, and when I was 42, so 5 years ago, I was diagnosed with breast cancer. At the time, I was working 4 days a week, commuting in and out of London. I'm a lawyer, I was working in a corporate law firm. Um, I've got two children at the time, they were 9 and 11, so fairly young. And I had a really, really busy life, like everyone, or all of us. So being diagnosed with breast cancer at that stage was a bit of a shock to the system. Obviously, a shock because being diagnosed with cancer is quite a shock, but also just when you're sort of getting on with your life and you think you're invincible and you just go to work and you have your home life and you bring up your children and so on and so on, and then to have all of that sort of thrown into the system. Um, so as I say, I was diagnosed with breast cancer. It was a strange diagnosis because I had a lump in my armpit, which is what triggered my sort of anxiety, or what's this is a bit strange, and went to the GP, and the GP wasn't really sure what it was. And I had a history of breast cysts, which are nothing to do with breast cancer, and they're not a precursor to breast cancer at all. And so she referred me to the breast clinic, thinking it was probably just something to do with breast cysts. I had a mammogram and an ultrasound, which didn't pick up any tumour, but a biopsy of the lump in my armpit showed breast cancer cells. So I had a breast cancer diagnosis, but not having found a lump in anywhere on my chest area by ultrasound or mammogram. And so I've had a number of scans, including the sensitive PET CT scan, which still didn't bring up a lump anywhere. So it's an unusual diagnosis to have breast cancer without a breast lump, because the lump in my armpit was actually the lymph nodes, which were enlarged because the cancer had spread into my arm. Slightly unusual diagnosis. I then had surgery to remove my lymph nodes from my left armpit. I had all lymph nodes removed. Obviously, I didn't
Thank you
have
for
chemo
sharing, and
treatment
I
for
think it
6 months
highlights that
because there was
breast cancers, they can be quite incidental findings.
radiotherapy, Herceptin, which is a biotherapy. That's something that you have for a year. And now I'm on hormone therapy, which I started 4 years ago, and I will be on with breast cancer. Obviously, the treatment that I had was determined by the type of breast cancer that I had, because obviously there are a number of different types of breast cancer. My breast cancer was HER2 positive, which is why I had Herceptin, and also it's estrogen positive, which is why I'm now on the hormone therapy. So it's been quite a long slog, and obviously still being on the hormone therapy means that I'm still experiencing some side effects from that medication. But yeah, that's where I am. That's where I am today.
I think as well from my experience, having done lots of breast reviews, lots of
Definitely,
patients
it's
say, "Oh, I didn't feel anything, and
it
then
was
I
a
went
real
for felt a lump one
opportunity
day,
to get
and then that's it. Now I'm
diagnosed
here for
when
treatment."
you're got
So
a lump in your breast, and actually that was something that I couldn't quite get my head around for a while. But my breast is retired now. He must have been about 70 when he saw me. He was very, very experienced, and he's half a dozen times. And so the fact that, because he was at least 70 and had only seen me that small number of times, just reiterated how unusual it was. Yeah, and it's actually really interesting because you also think breast cancer, you're going to find it by a lump in your breast, but you can get lumps in another part of your chest area. So a friend of mine, she had a lump near her collarbone, and which turned out to be breast cancer. So it's actually, whilst everyone is taught to check their breasts, which is great, and all women should be doing it, and men too, because men can get breast cancer too. It's important to know how to check and be aware properly, so that actually you're not just checking your breast area, but you're checking up to your collarbone and under your arms, and down that sort of side area between your breast and your armpit, because you can get an initial lump anywhere around there.
I know, just talking to other patients as well with cancers in other areas of their body, it is any lumps or bumps, isn't it, really, that anything that could potentially be different for you that you're not used to and isn't normal, that was typically what we would say to patients, is make sure you do go and get those things checked out. So in terms of your cysts, Sarah, were you used to going to the GP with cysts to kind of then be referred straight away to the breast clinic?
I found a lump when I was 40, and obviously it rang alarm bells, and I was petrified and thought, oh my goodness, I found a lump, I've got breast cancer. Went to the GP, got referred to the consultant, and he immediately knew that it was a cyst. I did have a mammogram, and he said to me that it's quite normal for women in their early 40s upwards to develop these breast cysts, and it's not just one or two. You can have loads of breast cysts in your breasts, and it's very, very normal, and it's hormonal, and I don't know anything else about it other than the fact that it's normal and it's hormonal, and it's not related to breast cancer. It's just a coincidence that I happen to have breast cysts, and then down the line I also have breast cancer.
So Sarah, you did mention a little bit about your actual treatment, and you mentioned you did have radiotherapy. Obviously, Naaman and I being therapeutic radiographers, we're keen to hear about your experience of radiotherapy. Can you remember kind of going into the radiotherapy department, what that experience was like?
It's funny how you kind of block these things out, but then when you have to remember it, it all comes flooding back. So I first of all, I had my radiotherapy at a different hospital to the hospital where I had my chemotherapy and my surgery. So that was at the outset a change for me, going to a new hospital. And when you're going through treatment and you get used to going to one place, and then you have to change to a different location, that can be quite difficult. But having said that, everyone at the new hospital was incredibly kind and supportive and really, really nice. And so, after the first appointment, I felt at home. So it was fine after that. It was it's slightly further away from where I live, so I had a slightly longer journey there and back. And I think that's, definitely a factor when you're having radiotherapy every day. And for breast cancer, for me, it was every day for 3 weeks. Actually, it was starting on a Wednesday. So I had it Wednesday, Thursday, Friday, break for the weekend, following week, break for a weekend, following week, break for a weekend, and then another half a week. So for me, going in every day to a hospital a little bit further away from where I live was very different to going to a hospital closer to where I live every week for chemotherapy, for example. So I found the change, it wasn't difficult or anything. It was just a change. It was just different to the first stage of treatment. I went for I can't remember what they called it, a radiotherapy sort of prep session where you go in, and which actually is really important, and I found it really helpful because you don't really know what to expect from radiotherapy at all. And so it was quite nice to go in and to be able to see where you would be having the radiotherapy itself. I had to lie down and have one of the radiographers sort of spend quite a lot of time putting me into different positions, and machinery above me was moving around. There was someone in the control room and moving the machinery around, and I know that it was to get me in exactly the right position so that they could target exactly the right area. And what I was really surprised about was the tattoos. So for breast radiotherapy, I had radiotherapy on the left side because the lymph nodes on my left side were the ones with the breast cancer cells. So that's why they thought that if there was breast cancer in the breast, it would be in the left breast. So I had 3 very tiny dots. It just looked like someone had taken a biro and sort of stabbed me with the biro. It was just very, very small. And that I found that really interesting, because that's obviously what they then used to line me up every time I went to get me in exactly the right position. So I found that really helpful going for the prep session, because it was really good to find out how things were going to work in terms of going in every day, what to expect, and then, you know, the fact that there wouldn't be someone necessarily in the room with me while I was going to have the radiotherapy. I was, because it was on my left side where my heart is, I had to do the holding my breath one, which again, before I went to this preparation session, I had absolutely no idea what to expect at all. And so I didn't know I was going to have to hold my breath, but because, and you can explain this much better than I can, because they needed to, they had to do it in a way that it wasn't going to affect my heart, and so you have to hold your breath, don't you? And you have to hold your breath for quite a long time.
You do.
And I actually had the contraption where you are, it's like you're going scuba diving and you've got a snorkel in your mouth, and then I had goggles on, and through the goggles I could see graphs, and the graphs were my breath. So it was really clever. And when a red line got to a certain point, I had to then hold my breath for a certain length of time, watching the line go across the screen. And when it got to a certain point, I was allowed to allow my breath to go so I could start breathing again. And yeah, that was really hard, actually. That took a bit of getting used to, because you're lying there in a very alien situation, and it's quite scary, because obviously it's cancer treatment. It's not something that you're familiar with. You're in a hospital, you're in a room on your own, you're lying on a treatment bed, and there's some machinery whirring around you, and it's quite cold as well, because obviously the machinery has to be kept at a certain temperature, I believe, and then on top of all of this, I had to hold my breath, and I seem to think it was about 30 or 40 seconds, which sounds like quite easy, but I think when you're slightly stressed, it's really quite hard to do.
Absolutely.
So that was also interesting, and I think I got used to it as time went on. I found it quite hard at first to hold my breath for that long, and I think I was putting myself under pressure as well to, you know, hold your breath, you've got to hold your breath, you've got to hold your breath. But actually, the radiographers always said to me, if you can't hold your breath, then just hold it for as long as you can, and we'll just come back and do another round of it. So it wasn't the be all and end all, but I think because you are lying there and you just want to do everything right, it was a bit stressful. So yeah.
Sarah, can I just ask, did you have any prep at all? So ahead of that first treatment, did you get any resources like a leaflet or a video or anything at all that kind of told you about what technically is called deep inspiration breath
I don't
hold?
remember receiving
Do you
anything,
remember receiving
and
anything?
I remember that Naman, you directed me to some resources recently because we were talking about it, and I remember thinking I wish I'd had that
Yeah.
when I had first had my first session,
Yeah.
because it was so helpful to have that beforehand. I did have a preparation session, like I say. I went in, they showed me where I was going to have it. I had the sort of preparation scans with the tattoo and the putting me in the position, and they did actually show me the contraption that I was going to be using, and said, just, try it on so you know what to expect and
Yeah.
hold your breath. But it was really a kind of showing me what to expect rather than some instructions of how to use it. And
Going through
I
it.
think it would have been helpful to perhaps have the video or a leaflet beforehand, because there is a bit of time between the preparation session and when you go in for your first radiotherapy session. So I could have practiced a bit. I could have really prepared myself a bit better.
See, Sarah, you will be pleased to know that the Respire project essentially created lots of resources now, and I'm really lucky I get to work with the professor that developed those, so Professor Heidi Prost, and she's actually coming on the podcast very soon to talk about all of her work that she does with breast cancer. But for anyone out there who does have patients or relatives that are going for breast cancer treatment, and also therapeutic radiographers that are working in departments, these resources are publicly accessible, and that leads me nicely onto the fact that these resources do also sit on your website. So Sarah, I don't know, do you want at this point to just maybe
Yes,
talk a little
okay.
bit about
So,
your website?
after I'd finished treatment, I think I'd finished chemotherapy and radiotherapy, I set up a website called tickingoffbreastcancer.com, which is, or was, because it subsequently moved over, but I'll tell you about that in a minute. At the time, I set it up as a website to help someone who, like me, had been diagnosed with breast cancer, was going through breast cancer treatment, because I felt completely overwhelmed by the information that was available on the big cancer charity websites. And I have to say, they are amazing. I've got nothing against them in the slightest. I think they're brilliant. They have such a lot of information. But for somebody who is in a state of shock, a little bit apprehensive about going online, being told, don't go online, don't Google, it can be a little bit of a scary place to go and look for information, just practical information, even like, what do you take to chemotherapy, or what do you expect, what to expect from radiotherapy. And so after I finished treatment, I was a little bit more, I was happier to go online, and I realised actually that not only are there the big cancer charities with all their wonderful, helpful information, but there's so many other organisations and smaller charities like yourselves who have such great resources and information and advice and practical tips, and you're not going to find it unless you know it's there. And actually, a lot of the time you don't know it's there, and you're not going to go on and, well, lots of people will not go on and Google and jump down the Google rabbit hole because it's just far too scary. And actually, most doctors will tell you not to do that. So by not doing that, you're not finding all this other wonderful information. And so I really felt that there was a place needed that would direct people to all the really good information out there. So that's what tickingoffbreastcancer.com was. It was practical information based on people's experience, and myself included to start with. It was me, but it's developed over time. So it was, these are the 10 things to know about radiotherapy if you're having breast cancer radiotherapy, what to expect. And then if you want to find out more information, for example, the the breathing resources that you were talking about. We've got links so people can then go and find those. So it was really meant as a heads up and of what to expect and practical advice, and directing people to where they can find lots of really helpful advice. And I set that up, as I say, when I finished treatment. So that must have been about 4 years ago. And then earlier this year, in January, we moved the website, all the practical support, and all our content over to Future Dreams Breast Cancer Charity, who are a larger breast cancer charity. They've been established since 2008, and traditionally, what they've done is to raise money for secondary breast cancer research, but also for other breast cancer charities or other breast cancer organisations that they would give grants to. So, for example, they might pay for a scalp cooling machine in a chemotherapy unit where a number of women are having breast cancer treatment. So, for example, that sort of thing. And they're an amazing charity, and they've recently changed what they're doing from just fundraising to now providing a support to women with breast cancer. They have a house in King's Cross in London, which is called the Future Dreams House, which is the only dedicated breast cancer support centre in London, which is quite surprising given that breast cancer is one of the most prevalent cancers in this country, with 1 in 7 women being diagnosed with it in their lifetime. So they have this wonderful, wonderful house, which they have refurbished and decorated, and it's beautiful and wonderful, and they are now just in the process of trying to set that up with support workshops, support groups, talks, events, with the aim for it to become a drop-in centre as well for anyone and everyone impacted by breast cancer in London and outside of London. Obviously, it's been heavily impacted by the pandemic, and that has had a real impact on sort of being able to get things moving. But slowly but surely this is happening. And so alongside of them doing that in person, they revamped their website and they approached me to ask if I would run their online support hub, which effectively is what tickingoffbreastcancer.com was. We've moved all our content over, and we now, as well as directing people to all the wonderful information that is out there and help and resources, which we've always done, we also have our practical hints and tips and checklists. We publish personal stories from other people who are going through breast cancer or who have been through breast cancer about any aspect of treatment or post-treatment. We post a lot of articles from people who are experts in their field. So we have a Q&A about scalp cooling from Claire Paxman, for example, who is a big part of the scalp cooling community, and all sorts of expert advice on there. And we've got a page for friends and family so that they can go on and get some information about how to help their loved one who's going through it.
Oh, thanks, Sarah. It sounds amazing, and I've definitely gone on and had a really good look. And I know, as part of Action Radiotherapy, soon to be Radiotherapy UK, that Naaman and I work for, I know Naaman has kindly helped support your radiotherapy section. So it's great to have therapeutic radiographers feeding in like that. And I'm sure Naaman will comment on all the work that he does. But Sarah, I also realised that you have quite a big social media presence as well, which is great in terms of just the reach that you have. Do you find you get many patients that you're linking with through things like Instagram and Facebook and things now?
The social media it's really just I suppose it's an extension of the website that I first set up. And I should say also that I now have 3 volunteers working with me on the website, and so we sort of see ourselves as, even though we're now part of the Future Dreams family, we're still very much the ticking off breast cancer team. And our social media accounts are an extension of us and what we're putting out on the website. And it's a way for us to just communicate and engage and interact with people who are going through breast cancer treatment in a more direct way than through the website. So we're on Twitter, Instagram, Facebook, and what we tend to do is we will talk on social media on those platforms about the content that we've got on the website. So for example, like you say, Naman really kindly reviewed all our radiotherapy. I know that it's been certified by a radiotherapy so so it's actually, it gives it a little bit more credibility. And so when he had done the review, I was able to just go out on social media and say, just remind you that we've got this content on radiotherapy. It's just being reviewed by Naman, etc., etc. And it just engages people and lets them know what's on the website. But I suppose to your point as well, we do engage and interact a lot with people who are going through breast cancer treatment. So they may well comment on something, then someone else will comment, and then we see conversations starting up. So someone might be asking, oh, in answer, in a comment on the radiotherapy post, for example, I'm just about to start radiotherapy, I'm a little bit worried about it. Anyone got any tips? And then someone else will come in and give some advice. So actually it's a really nice way for people to interact with each other and not just with us as well. And also what we find is it's a really good opportunity for us to use social media to go out and ask people what they need and what information they need and what they're looking for and what questions they've got. So for example, we also have
thank you for sharing. I should say quickly, thanks for the opportunity to work with you just on those pages and stuff. I know we did it with Action Radiotherapy, soon to be Radiotherapy UK, but it's something that one of our previous guests, Rachel Moses, said a lot is, if you're promoting a profession, promoting what you do, try and do some, it doesn't have to be for you, it's you are helping patients in some way, even if it is that information. So I suppose just to follow up, if you don't mind me asking, Sarah, what sort of advantages do you think there is, or there are, through social media of patients connecting with clinical colleagues, such as like Joe and I as therapeutic radiographers, for example?
To find out what people want to know, people who are going through it right now or have finished treatment, because we also cater to those who have finished their treatment. So it's just a really good way to interact with breast cancer patients and just know exactly what they want to know, really. Yeah. I think it just informs and educates the patients. When you're going through treatment and you are going to your appointments, the environment that you're in, and especially with COVID and people having to go on their own, you're sitting in a room with a surgeon, oncologist, or you're in a radiotherapy suite with the radiotherapy team. Whatever the situation is, it's quite stressful, it's quite scary, and quite often you forget what you're going to ask, or you get home and you think, gosh, I didn't ask that question, or you then have another question, you think, I don't know where I'm going to get the information from because I have another question. And I think the thing about social media and with professionals interacting with patients, it's not a question, it's not a case of a patient having a question about their own personal situation and wanting an answer and trying to find someone on social media who can give them an answer. That's not the situation at all. It's more, I suppose, a generalized way of educating and informing and learning about treatment plans. So, for example, there's clinical trials. So there are lots and lots of clinical trials for breast cancer patients, particularly those with secondary breast cancer, stage 4 breast cancer. And not all oncologists know about all the trials that are available. And so we work closely with an organisation called Ancora, who are creating I suppose it's a database that makes clinical trial information easier to access for both patients and oncologists. And by working with them, we're bringing that information to the patients, but we're also bringing information to the professionals, and then we're putting those in touch with each other. And so there's then a general discussion around clinical trials involving Ancora, patients, oncologists, and medical teams. And so I think it's just, it's such a big question. It's kind of thing. I could talk about this for quite a long time, because there are so many ways in which social media can help patients find out more information and ask generalized questions, but also for professionals to really see what patients need. So I think certainly since I was diagnosed 5 years ago, even in the last 5 years, there's been a huge push towards integrative medicine, whereby the school of thought is that you go for your surgery and everything, but you complement that by exercising, eating a healthy diet, managing stress by perhaps practicing yoga or mindfulness or whatever it is, and it's integrating those other forms of therapy into your conventional medicine. And I've noticed a real push on that and a real trend. I think trend's probably
Yeah, sorry.
It might go away, but I don't think
No, it was good. I thought it was well explained.
Yes.
If we were interviewing, I think I would have given you some marks there.
And
Sorry, it was more of an interview question, I think. It was just interesting. As you said, the shift towards social media at the moment, it's amazing. And Jo, I know you've been doing some work around public health and prehab.
About the importance of exercise and eating a healthy diet and managing stress and all these really helpful things, and it's just a great platform for getting that information out there. Not everyone has their own website, and actually that used to be the place where people would post their information, but now you can just talk to people directly on social media. It's really helpful. I'm not sure if that answered the question, actually. I probably just went off a complete tangent there. Sorry.
Yeah, so as part of a fellowship that I did with Macmillan, we were looking at prehabilitation, rehabilitation, personalised care. And absolutely, Sarah, it is about making sure that everyone who has contact with patients has the ability to be able to help inform those public health messages that ultimately could have a really positive impact on patients' lifestyle, patients', overall health. And yes, you obviously, from our perspective, have cancer. We want to treat that cancer, but we also have the ability to make great adaptations in your own life that hopefully will reduce your risk of other diseases. We're really good now at curing cancer, but we also have that opportunity then to make impacts on heart disease, on blood pressure. And I know you mentioned it a few times, Sarah, and I know looking at your book and going through that, just the stress and anxiety that maybe some women face even before they get diagnosed with cancer, just being on that treadmill. You know, I've got to work until 7 o'clock, then I've got to get the tube home, then I've got to make sure the kids' dinner are on, I've then got to take them to hockey, then I get in, then I have my dinner, then I make their school lunches. You know, that whole treadmill is very fast paced, and then you add cancer in the mix, and actually sometimes that forces people to reevaluate their lives. And I know, talking to cancer patients a lot through education, sometimes it's
And that
it's
exercise
almost
element.
like the time
I
that
love
they
my
need
exercise,
to
and I talk about it to
reflect
every
on,
patient
am
if
I
they want to
doing
hear it
all
or
of
not,
this
to be honest.
for me and my
Because it's just 30
family?
minutes a day,
Is this
and
what
that
we
can
really
be
want to
hoovering.
be
So
doing?
the World Health
Cancer can
Organization,
sometimes
they class hoovering as
reprioritise
exercise.
what's
So
important.
that counts. There's a
And I
lot of
know that
evidence
that's
now,
something that you've talked about as
which
part
I
of
can
your
find a link and
book.
we can post it with this
And I
podcast,
think,
but
you know,
around
having that
just for your
ability
chemotherapy
to
appointments,
just
walking to your
reframe,
chemotherapy,
but absolutely for the healthcare
whether it's half an
professionals,
hour, 20
every
minutes, that
contact
can
does
be,
count.
you know,
If
a
you don't
precursor to,
know the
well,
guidelines
better
around every
outcomes if
contact
you want, and
count,
not
you
having some
have to
side
read
effects.
it. Naaman and I will
So yeah,
definitely post
as Joe
it.
said,
You need
there's a
to
lot of
read
research
it
going into it
because the
now.
impact is
Sarah, I know
important.
you touched
And
briefly
you know,
on
making sure
sort of
that
the advice
patients
that you,
realise the risks that
you know,
they
that you're now
are
giving
putting
through,
themselves under
ticking
if
off
they are
breast
smoking or
cancer for
drinking
your page and
excessively.
also
You know,
through
the
to Dreams
impact that
charity.
doing your
Would you
10,000
feel
steps a
comfortable
day can
sharing what
have,
kind of
not just
advice
on your
you were given
physical
during
health, but also
radiotherapy?
mental health as well. So absolutely, I think it's really important that we do treat patients with
So
personalised
whether it's
care, but
around,
offer
you
them
know,
that holistic care
eating
and support
habits
as
or
well.
skincare or tiredness.
The advice that was given to me. Uh, I think from memory, I think there was limited advice given to me at the time. I think I I wasn't told anything about diet or exercise. I was told that I would feel tired and that it wouldn't be apparent to start with, but it would, as time went on, I would gradually expect to feel tired as time went on, because I had 15 sessions, as I said, with breaks of 2 weekends. So they said expect to feel tired, and you'll need to use a good cream for your skin so that it doesn't blister. And actually, I was told start putting the cream on now, and I think that must have been a week before, and that was the best advice that I was given. And I know not everyone is told that now. And if I talk to anybody who's about to start radiotherapy, I always say to them, start putting your cream on now, because there's no point in waiting until you start or until your skin starts to get red or sore. It's preventative, not just treating the symptoms. So that was really good advice given to me. But I was given the exercise advice when I was going through chemotherapy, which actually surprised me, because I thought, oh, I'm having chemotherapy, I'm going to need to rest and, rest up and, preserve my energy and, allow my body to cope with this. I'm going to be in bed, or I'm going to be lying on the sofa. And actually, the last thing I felt
I
like
always
was
say, it's my line I think I use with every patient, ironically, the best answer to fatigue is
my
exercise. There's
chemotherapy
so many
nurses
sort
made
of
it
journal articles, blogs, whatever you want to read, not just the sort of the mental well-being side of things, but the physical side of things, just to keep moving, even if it is just walking or parking a little bit further away, walking somewhere. Exactly as you said, there's a lot for it.
It's interesting as well, Sarah.
I did what I could within the limitations that I felt I was able to, because I did feel dreadful through chemotherapy. But with radiotherapy, I wasn't no I exercise wasn't discussed. But what do you guys say to your patients about exercise through radiotherapy? Is that something that can help with the fatigue that you experience? Yeah.
It's interesting as well, Sarah, because at the minute I'm doing a piece of work with a couple of colleagues up in the Northwest, and we're actually reviewing therapeutic radiographers' knowledge around lots of different prehabilitation and rehabilitation themes and areas. And a lot of therapeutic radiographers feel hypocritical about maybe giving health advice to patients. Some of them feel that actually they don't have the education that they need to be able to offer this advice. You know, when you talk about diet and exercise, should it really be a physiotherapist that's offering that advice? And we've also found as well that, you know, some therapeutic radiographers don't necessarily have the communication skills to maybe have difficult conversations with patients. If you have a morbidly obese patient who is going through a really tough time in their lives, you know, the fact that you're having to talk to them about diet and they're like, are you joking? I've got cancer. Why do I want to now start focusing on my diet? And this is typically why people will avoid having those conversations with people. So we are doing lots of work at the moment around evaluating some e-learning resources, and this will go on to develop some research, hopefully in this area. But it is really interesting that your experience is quite typical, that therapeutic radiographers maybe aren't having those conversations. And don't get me wrong, I think there are lots around the country, really good practice, you know, but I think it is those therapeutic radiographers that are maybe educating themselves or doing continual professional development in that area, or go out and do the research, look at the evidence base, or relying on the consultants. And we know that actually it's us being able to see patients every single day that you can make those tiny little suggestions around what you could do. So when people go, oh, you know, I'm struggling with fatigue,
Maybe
I always talk to patients about how is your sleep. You know, there's lots of educational resources around sleep hygiene, and yet actually yes, you might want to refer to physical activity and exercise, but there is also lots of resources around sleep hygiene, when to exercise, when not to exercise, how having a routine is really beneficial for patients to get into a nice mindset, mindfulness. You know, there's loads of amazing apps now. There's nice sleeping apps so that it starts to remind you when to wind down, when to turn off electrical devices and things. And I always laugh actually, because when I started at Macmillan and the chief medical officer said to me, right, Joe, we're going to develop these resources. Why don't you look at sleep? And I just went, I'm a therapeutic radiographer. I don't know anything about sleep. Anyway, I took on that
really
bit of work with such vigour. So you could ask me lots of things about sleep. I could probably do a podcast on it. Maybe we will, Naaman.
To give this sort of advice to patients, because I think from a patient's perspective, it would be really welcomed, because you look to the person who's giving you the treatment, i.e. the therapeutic radiographer, as
Yeah, I
knowing
completely
very,
agree.
very
It's, as Jay
clearly
said, making every
side effects and how to
contact
deal
or
with
every
the side
conversation
effects.
count.
And so if they were to
And I know you
say,
mentioned about
you know,
getting
how's your
quite good
sleep
skincare
and
advice,
your
Sarah.
appetite,
That's really good to hear. And I
you
know
know,
our
whatever
Society
they
and
were to
College of
say, we would
Radiographers,
take it
so
on
last year
board
they produced
because
some
that person's
fantastic
giving you
skincare
the
leaflets, which I think
expert
encompass lots of
and
questions that patients have asked
researching
before.
about
So, can I go
hundreds of
swimming?
people all the
You know, can I
time.
wear
And
deodorant?
so
Can I
you can
shave?
rely
All
on
of these
that
sort of things that were nice and
expert's
very
advice
concise in a
rather than
leaflet, which I
having to
know
sort of
you've kindly added to your
sort of
to the web
internalise
page
those
as well, which I know
ideas
is
because they're quite
yeah, I love
expensive
handing
to
them out.
set
They're really
for
really
top
concise and good.
contact for breast cancer.
Um,
You know, it's getting the information from the professionals, i.e. the radiographers, to the patients, which is so important. And you know, we're there, we want to know it, we want to be told this because it's all going to help us at the end of the day deal with all the side effects.
I think, to be perfectly honest, because of COVID, we've stopped handing lots of things out. I have had a workaround, and I've been emailing almost every breast patient or any other kind of site which I know they might be at higher risk of a skin reaction. So just emailing them if they're obviously comfortable doing so. If not, we're looking at printing them out. I know the Society College of Radiographers last year they did send quite a few out to lots of departments to trial, and mostly all departments have looked into how to sort of get them printed out locally and hand them out a bit
And
more.
are those leaflets
Um,
available at
so
the
it's
radiotherapy
definitely there. I think emailing them at the minute is quite nice because obviously you've got it on your phone.
treatment
Again,
areas
it
that you're
depends on
managing? So they're the sort of
if
things
your
that we
patient has
need
any protective characteristics that
to
might
pick
stop
up
them
when we
being
go for our first
technologically savvy.
session or our prep
Um,
session and go home and read a simple leaflet with some simple straightforward advice. That's true. Yeah. Yeah.
I think as well, it does require the departments to engage. So you, I know from experience that there are some departments that offer slightly different advice to the Society College of Radiographers, and I think it is really important to note that everything that the Society and College has produced is evidence based, it's research informed, and I think from a patient's perspective, I would certainly want to know that the information that I'm being given is backed up by the research, which a lot of the time we always assume. So I myself have been a patient and I take whatever my consultant says to me as gospel. Yes, I will absolutely do whatever you want me to do, even though in other areas of my life I definitely don't listen to anyone. But from that perspective, absolutely. So I think it is important that we are looking at evidence-based research, using the research as much as we can, because we are advising patients about how best to look after themselves. And I know, Naaman, you're looking to do an amazing project and take this forward, which you might want to divulge, you might not within the podcast, but I definitely think that it is really important that all of the advice that we offer patients has that research behind it, so that you can truly say with confidence, we know that you doing this is going to support you, this is going to make a positive outcome for your treatment, your prognosis will improve, or your side effects will be less as a result of doing this. So it is something that we are really passionate about, and obviously as part of the podcast as well, everything that we do, we try and support with that educational perspective, also having that research and evidence base behind it. Do you find that that's maybe beneficial, Sarah, from your perspective, linking maybe more with clinical colleagues and doing your own investigation? Because I would just worry that sometimes patients don't have the education to be able to sift through some of that information that's presented.
Research either, because it's in a state of shock, feeling vulnerable, not knowing which is up and which is down, because their whole world feels like it's been turned upside down. And so actually what we do is we link to really reputable sources. So for example, the information that Naman has provided on the radiotherapy section of the website, that comes from a very credible source. We trust it. We will refer people to it. We wouldn't just link to any old article. We have to be quite comfortable, and we will usually go with the well-known charities, organisations.
I completely agree. It's that evidence-based kind of behind it, and I suppose, again, I'm going to say it again, but thank you for the opportunity to sort of help with all the pages and stuff like that.
Expert advice article, what their credentials are. So we prefer obviously to have people like Naman. We have a number of breast surgeons who help us out, oncologists, trained cancer rehab, fitness instructors, so people who have had the training and have the qualifications. Yes, very much so. It's definitely really helpful to get the information from them onto the website, because we feel that that's what's going to help the patients at the end of the day. Oh, thank you, Naman. It's just, honestly, we couldn't do what we do without people like you giving us your time and just, casting an eye over our content, telling us what we're missing, or what perhaps shouldn't be on there. What we do is we only provide practical tips. So we are patients giving other patients advice. And so it's really, really helpful to have people who are experts in their field to come on and check what we're saying, really, because at the end of the day, we're not medics, we're not professionals. We're just saying, oh, this is what I took to chemotherapy, this is what I prepared, this is how I prepared for radiotherapy. You might want to do this as well. So having someone like yourself look at that and say, yeah, that's absolutely fine, and here's some extra links that you might want to direct people to, is fantastic. And that's going to help endless people. It's brilliant.
I do have to say, though, vice versa, being a healthcare professional, I learn so much from patients, and it is hugely beneficial. When you're telling your story, it's just really interesting to see your perception of things. So there are times as a healthcare professional we'd jump in and go, oh, well, no, that's actually a CT scan, or no, this is what we're doing here and then. But actually hearing it through a patient's words, the whirring of the machine, it's not necessarily something, should we be saying this is what the whirring of the machine is? But it's things like that if you actively listen to what patients are saying, you will learn a lot more, and you can help advise then further on down the line to other patients to really say, this is what the experience is going to be like, rather than from my perception, well, I'm used to doing X, Y, and Z. It's just going to be really quick and easy, really simplistic. You won't get any side effects. We're absolutely fine. Let's go. When actually, from a patient's perspective, they can go, well, that's from my perspective, that's absolutely not the case. So
I say this to my patients, I say that to my patients, and then when actually I listen to patients, I realise maybe I should be describing it in a different way or explaining things slightly differently. And on our website we publish personal stories from patients, so people talking about an aspect of treatment or the general experience or whatever it might be. And so for people in the professional side of things, it's interesting for you to read those, because then you get even more of an idea of what people's experiences and perceptions of treatment are. And actually it's really interesting because people who have read my book, so I wrote the book about my own experience, which is, I'm not medically trained or have a medical background or anything in the slightest. So my book is describing the whirring of the machines, or there was this big donut that I had to lie in the middle of and it went up and down, and just explaining things from the perspective of someone who is so far from a medical background that you could get. And actually the professionals who have read it have said exactly the same as you. It's perspective from the patient, so that you can understand their way of thinking. And I think I don't know whether it's always been the way, but there's certainly a really big push in sharing the patient's voice and getting the patient's perspectives. Today I was on a call for the Thames Valley Cancer Alliance, which I'm part of the patient, I can't even remember what it's called. It's PPG, and I don't even know what that is. But it's listening to patients. No, because we're all patients, so we don't know what these abbreviated groups names are. But it's all about patients sharing their experiences, having the voice, so that cancer
Don't worry, I bet you half of the members don't know either.
can be improved. And I wrote the chapter on the patient's experience for the new UCON's UK Oncology Nursing Society manual, which came out this year. And again, that's something that they're trying to do with that, which is to, that's for trainee nurses, oncology nurses, and it's a chapter in my words about what I went through, how I felt, so that they're not just learning about the drugs and how to put a cannula in and this, that and the other. They're actually also learning about how does a patient perceive their treatment, and what are their big concerns, and what are their pain points, and so on. And so I think it's and this podcast as well, having someone who's been through it like myself, and if you've got radiographers listening to this, that's going to be really helpful to understand where a patient is coming from. So I think the more that professionals can listen to patients, the better, really.
Yeah, and I often find that we do it a lot. So a lot of the higher education institutes that teach allied health professions, medics, nurses, we use service users a lot to help educate students because we recognise the importance. But sometimes that stops. So as part of continual professional development, you will be, you'll be a band 5 qualified member of staff, and you'll have that patient voice echoing through everything you do. But as you get more experienced and you have longer in the profession, you kind of lose sight of that, or things change and the perception then of the patients change. So your kind of explanation of deep inspiration breath hold, a qualified member of staff may never have really listened to a patient talk about that experience from their perspective, but that's because they trained 20 years ago and they haven't had that opportunity to listen to patient voice. So absolutely, it's something I know Naaman and I are really passionate about, hence the podcast, which which hopefully will really help resonate with people. So Sarah, we are ticking on for almost an hour. So one of our longest podcasts, but you've been absolutely amazing. Before we wrap up, can I ask, are there any top tips that you would want to give to any healthcare professionals treating cancer patients that you think will help improve their practice or patient experience?
Especially given the current circumstances. So, I do want to give some tips, but I don't want that to be seen as me, saying actually everyone's doing a really bad job, because that's so far from the case. But what I would say, and it's something that we've discussed a lot this evening, it's about educating the patient and it's about informing the patient, because I think some healthcare professionals may feel that they're helping the patient by not telling them everything because they don't want the patient to stress. But actually, that's counterintuitive, because actually you then find out down the line about something and you stress about it even more. So I just think, the big tip really
thank you very much for the tips, Sarah, and thank you for everyone listening to Rad Chat this evening. So your hosts today have been Naaman Joel Cranderson and Joe McNamara. A huge thank you again to our guest, Sara Liyanage. So if you're utilising this podcast for CPD purposes, consider the reflective questions posted with this podcast, along with the links to resources and literature discussed within the podcast. To receive your CPD digital badge, please complete the form linked with the podcast. You may have already seen, but we have now received Society and College of Radiographers accreditation for CPD, which is amazing. So for anyone having to do their HCPC audit, this is a great way to demonstrate CPD.
When you're feeling up to
Naaman, you should use the clapping hands that we've got now on our podcast software.
So our next guest to feature will be Dr. Liz O'Riordan, discussing her experience of breast cancer as a patient and as a surgeon. We have something very exciting to share with you all too. We'll be officially relaunching the podcast next week, so look out for our logo and branding changing all over social media. Thank you and good night.
Thank you. Naaman, you should use the clapping hands that we've got now on our podcast software. Thank you. Good night.